Tracy Tyson, general pediatrician. Let's talk teenagers. It's one of my favorite age groups to treat. I think these are such a fun time. You can make such a difference in a teenager's life. So it's something I feel really passionate about, and most of us in pediatrics do. So, what happens when you go to the pediatrician or family practice provider? They ask to speak to your teen alone, especially during a wellness visit. What is really going on? How are we handling things? What are the child's rights? So, I think one thing to remember is this different state by state. It used to be a little bit more uniform, but things have changed a little bit. And I think there is some fear from parents. There's something going on in the exam room where we are actually giving our own opinions and advice to your children about how to live their life. And that is not true. Of course, I can't speak for every person, but in general, that's not what we're doing. So what are we doing? We are screening them for all sorts of determinants of health. We are asking about drug use. We are asking about sexual activity, violence in their life, whether there's any bullying going on, how is their mental health? What are their plans for the future? So many of these risk factors about driving. Are they texting when they're driving? Are they wearing their seatbelt? Is there anything going on in their life that is unsafe or unhealthy? In general, these are things parents already know about. It's just that the teenager feels more comfortable talking sometimes when the parent or guardian is not in the room. When we ask these questions, the goal is not to find out something that you don't know. The goal is actually to just get the rapport with the child so that they feel more comfortable talking. They understand how important it is to let people know about these risk factors. What advice do we give? If a child is not a danger to themselves or anyone else, we talk to them about the health risk factors. We talk to them about how to protect themselves, how to stay healthy. We talk to them about how to talk to their parents. We guide them on medical treatment. That is it. We don't do anything else. So it's not my job to lecture them. It's not my job to preach to them. It's not my job to teach them morality. That is the parent's job and the rest of society's job. My job is 100% to keep them safe and healthy. Teens respond really well to this. They're lectured in so many areas of their life. They really like it when someone just says, okay, that's a risk factor. If you're not willing to change the risk factor, then this is what you need to do to keep yourself safe. Ultimately, that is our goal. We want healthy teenagers who turn into healthy adults, and it's the rest of society's job to establish any morality to anything. So we always ask children, can we help them facilitate any conversations with their parents? But I also want parents to realize that not every teenager lives in a safe environment. So not every teenager can safely share information with their parent or guardian. So we are going to protect that as best we can so that the child stays safe. Again, that is our job. So just know, if you're entrusting your children to us, we take that very seriously, but we're on Team Teenager. And our job 100% is to be on their team, on their side, and do the best we can for them. That usually aligns with parents' goals. And honestly, whenever I have these conversations, there's a parent in the room, because sometimes the teen doesn't want them to leave. Sometimes the parent doesn't want to leave. The parent is always like, thank you so much for saying all of those things. Those are the things that I say, but they don't listen to me. So it is nice to have another adult. Hopefully they've established some mutual respective relationship. It gives them another person to share things with. So it's amazing what we get out of teenagers. We know we're only scratching the surface. Most teenagers are still not telling us what's going on. So we need to keep doing this. We need to do a better job. So find someone that you know and trust. Talk to them about what they're saying to your teenagers. Help us do the best job we can with our teenagers, because they're the ones that are about to go out on their own. They need to know these things, and they need to be as well prepared as possible. Take care.